Landing a CRNA school interview is a huge accomplishment. It means your application impressed them. But here's the truth. The interview is where acceptance is actually won or lost. I've compiled the 15 most common CRNA interview questions with sample answers that actually work. By the end of this video, you'll know exactly how to prepare and what admissions committees really want to hear. This could be the difference between an acceptance letter and a rejection. Let's get into it. Before we dive into questions, you need to understand what interviewers are actually assessing. By the time you're invited for an interview, they already know you meet the academic and clinical benchmarks. The interview is where they assess communication skills. Can you articulate complex ideas clearly? Clinical judgment. Do you think critically under pressure? Professionalism. Will you represent the program well? Self-awareness. Do you understand your strengths and weaknesses? Commitment. Are you genuinely passionate about becoming a CRNA, or are you just here for the salary? Cultural fit. You thrive in this program's environment. Interviews typically last 20 to 45 minutes per applicant. You might have individual interviews, panel interviews, group activities, or clinical scenario discussions. Here's the key insight. They're not trying to trick you. They want to see the real you, your thinking process, your values, your genuine passion for anesthesia. Now, let's go through the questions. These explore why you want to become a CRNA and whether you understand the profession. Question 1. Why do you want to become a CRNA? What they're really asking, are you genuinely passionate about anesthesia or just chasing the salary? Strong answer approach. I've always been drawn to critical thinking and high-stakes decision-making. As an ICU nurse, I've cared for patients in their most vulnerable moments. I want to expand my scope and take on greater responsibility. Becoming a CRNA allows me to combine my love of physiology, pharmacology, and critical care with the autonomy to make independent clinical decisions. Avoid vague answers like, I want to help people, or focusing only on salary and lifestyle. Be specific about what draws you to anesthesia. Question 2. What do you know about the CRNA profession? This tests whether you've done your homework. Know the scope of practice, that CRNAs provide anesthesia across all surgical settings, work independently in many states, complete doctoral-level education, and are critical to healthcare access, especially in rural areas. Question 3. Why this program specifically? This is where research pays off. Reference specific faculty, clinical sites, curriculum features, or alumni you've spoken with. Don't give generic answers, they'll know. Question 4. Have you shadowed a CRNA? What did you learn? If you haven't shadowed, do it before your interview. Talk about what struck you, the constant vigilance required, the autonomy in decision-making, the blend of science and clinical judgment. Give specific examples. Question 5. What are your long-term career goals? Show ambition balanced with realism. Talk about becoming a skilled, confident CRNA first, then your interest in a specific area like cardiac anesthesia or rural practice, maybe eventually mentoring new CRNAs or contributing to the profession. Avoid saying you want to retire early or open your own practice immediately. Those aren't inspiring answers. These assess your critical thinking, clinical knowledge, and ability to stay calm under pressure. Question 6. Walk me through how you would manage a patient with hypotension in the ICU. Use a systematic approach. Assess patient. Vitals, signs of shock. Identify likely causes, hypovolemia, cardiogenic, septic, distributive. Intervene. IV access, fluids, vasopressors as appropriate. Reassess response continuously. Show you understand pathophysiology and prioritize patient safety. Question 7. What would you do if a patient's oxygen saturation suddenly dropped? Immediately assess airway and breathing. Increase oxygen delivery. Check for common causes, mucus plug, pneumothorax, bronchospasm, PE, Equipment malfunction. Auscultate lung sounds. Initiate appropriate interventions while notifying the physician. Think out loud. Show your thought process, not just actions. Question 8. Describe a time you cared for a critically ill patient. Use the STAR method: situation, task, action, result. Be specific. Describe the patient, what happened, what you did, and the outcome. Show your clinical judgment and what you learned. Question 9. How do you manage a patient on multiple vasoactive drips? Talk about constant monitoring and titration, assessing hemodynamics, blood pressure, heart rate, cardiac output, SVR, titrating each drip based on desired effect, ensuring dedicated IV lines, checking concentrations, monitoring for side effects, documenting meticulously. Question 10. What's the most challenging ICU case you've managed? Choose a case that highlights your critical thinking, collaboration, and ability to handle complexity. Walk through the challenges, your thought process, and what you learned. ECMO patients, post-cardiac surgery complications, multi-organ failure, these make great examples. These assess your professionalism, teamwork, and self-awareness. Question 11. Tell me about a time you had a conflict with a coworker. Show maturity and professionalism. Describe the situation briefly, how you addressed it with respectful, evidence-based communication and the positive resolution. Never badmouth others. Example approach. I disagreed with a physician about pain management. Rather than arguing, I calmly presented my assessment at the bedside. Seeing the patient's condition, the physician agreed to adjust the plan. I learned that respectful, evidence-based communication resolves conflicts. Question 12. Describe a time you made a mistake. What did you learn? Be honest and show accountability. Describe what happened, that you took responsibility, filed appropriate reports, and what you changed. Show how it made you a better, safer nurse. Never minimize the mistake or blame others. Growth mindset is key. Question 13. How do you handle stress? Talk about thriving in high-stress environments through organization, prioritization, and clear communication. Also discuss healthy coping mechanisms outside work, exercise, family time, whatever applies to you. Avoid saying, "I don't get stressed." That's not believable. These test your professional judgment and values. Question 14. What would you do if you witnessed a colleague diverting narcotics? Patient safety and ethical practice are paramount. Document what you observed. Report immediately through proper channels. Charge nurse, nursing supervisor. Trust the system to investigate. Show that you prioritize patient safety and understand professional accountability, while also recognizing that addiction is a disease that requires appropriate intervention. Question 15. A physician orders a medication dose you believe is unsafe. What do you do? Respectfully question the order with clinical reasoning. If concerns remain, consult pharmacy and follow chain of command policy. Do not administer a medication you believe is unsafe until the issue is resolved. Patient safety always comes first. Show clinical judgment, assertiveness, and professionalism. Never leave without asking thoughtful questions. This shows genuine interest, strong questions. What qualities do your most successful students share? How does the program support students who are struggling? Can you tell me about the variety of clinical sites? What opportunities exist for students interested in? Insert your specialty interest. How does the program prepare students for the NBCRNA exam? Avoid asking questions easily answered on their website. Don't ask about pass rates if you should already know them. And never ask, "Can I work while in the program?" That suggests lack of commitment. Final tips. Practice out loud beforehand. Know your application cold. Be ready to expand on anything in your personal statement. Stay calm under pressure. It's okay to pause and think. Be authentic. Don't try to be someone you're not. And let your genuine passion for anesthesia shine through. Dress professionally. Business attire. Arrive early. Make eye contact, project confidence without arrogance, and always send a thank you email within 24 hours. If this helped you prepare for your interview, smash that like button, subscribe for more CRNA content, and check the description for additional resources. Drop a comment below with your biggest interview concern. Head to CRNA